Good morning, good morning, good morning, everyone. How are you doing? Or it's afternoon, actually, right now. So, as you see, I have a special guest with me. But before we get started into this conversation, as we continue our conversations about the changes coming with the Big Beautiful Bill, make sure you share out this broadcast. You may be aware of this information, but I guarantee you, as somebody who's going to need this information, and come January, a lot of folks are going to be shocked about all the changes that are happening. So that's why we're having this conversation today. Before we get into that, make sure you go to our website. We have the last few events happening for the year at the Chamber organization. New members, if you're a new member, last orientation for this year is November. We also have a member appreciation day, so make sure you stop by there. And then we have our annual closeout event, which is our networking event. It's open to everyone, so we encourage you to come out and join us for that. And of course, we just have like 2 economic impact calls happening for the rest of the year. So November, December, and then we'll close out. November, we have DA Jared coming on. So he has a lot of information for our community to share and so forth. But I don't want to keep you guys too long. You know, we like to give you a lot of information here at the organization. Make sure you can prepare yourself, your business, and your family. So this is what this talk is about today. I have Ebenezer from Wellstar Health Systems with us today. He's telling me that he's an expert because he said he's been working for like 30 years. That's like more than half my life. So he's going to share with us actually changes that are coming from the Big Beautiful Bill. This is a serious topic that we want to discuss because this is going to impact how we live our lives. Honestly, guys, I'm just going to be real with you. You've been hearing a lot about that all year from us. But Ebenezer, while I do some back end stuff, I'm going to let you introduce yourself to the audience. I'm just going to make sure that everybody can hear us fine and share out our broadcast. So if you could go ahead and just let people know a little bit more about yourself before we get into this conversation today.
Good afternoon to you all. My name is Ebenezer Erzuah, and I've worked in the government programs reimbursement area for over 30 years. I started in Vermont and then to New Hampshire, and then from New Hampshire to Indiana, and then from Indiana to Michigan. And then finally, I wised up and moved down to the warm climates of Georgia. So I've been in Georgia for 16 years, working with Wellstar Health System.
Thank you for that. So, I brought you on here today because I had to pull all that knowledge into our audience just to talk about the Big Beautiful Bill and all the changes that are happening. But before we get into that, I just want to point out some key points that people may not be aware of. We've heard about the benefits. I've done a talk about it at one of our events. But just so you guys know, we have massive cuts coming federally to Medicaid, which includes children's CHIP program, which is looked to be about 1.2 trillion over the next 10 years. That's going to impact, Georgia. Cuts and reforms to the SNAP program, which everybody's know we're dealing with the government shutdown, and everybody's hearing about, SNAPs not be able to be, received next month for SNAP recipients. And we already know the cost of food is impacting all families. Everybody's talking about how much they paid in groceries last year's versus this year and how much they're able to get and so forth, and how their bills have risen. That's about a 68.6 billion cut over the next 10 years from this bill. Then we also now have a work requirement for SNAP and for Medicaid benefits, so that if you got recertification and so forth, which I know some of those letters have been sent in our area as early as August of this year, because I know several people who receive that information or have family members that they're taking care of. So you want to be sure that you are replying and responding to those shifts. So a lot of the costs are going to go down to the states and the municipality to handle those additional costs that the federal is no longer taking. But Wellstar, I have Ebenezer here today because we got to talk about Wellstar, which is in our community. They're great partners, but you guys take care of healthcare throughout the state of Georgia, and especially here in our region now. And you're building a new hospital out in Columbia County, but then you have our downtown that used to be MCG. You have our hospital here. So it's very important that patients understand how they're going to be impacted by this bill. Can you share that with us, how the Big Beautiful Bill is going to really impact those healthcare costs here for the state of Georgia?
Sure, yes. In general, I think the the Government Accountability Office or the Budget Office of the government has determined that Medicare, for Medicare, Medicaid, and the CHIP programs, and also assistance to undocumented aliens, as they call it, the total in that area alone is gonna be a cut of about $320 billion over a 10-year period. For hospitals, that's a big deal because usually most hospitals have, I'll say, half of the patient population coming out of these two government entities. By that, I'm talking about Medicare and Medicaid. So any cuts that comes down the line in that sense, it's a big deal to us. For Wellstar and also for hospitals located in Georgia, fortunately or unfortunately, we did not expand Medicaid. So some of these cuts would not impact us directly. But if I can go back a little bit for FY 2025, which is in the case of Wellstar, is from July 1, 2024 to June 30th, 2025. The cost, the payment cost of what we provide, the cost of what we provide to the Medicare and Medicaid patients, and what we actually receive in payment is close to $700 million. So already the federal government and the state governments are not paying us enough to cover the cost. So somebody would ask, okay, how do you basically make up the difference? One, we do the best we can to reduce cost by being very cost effective. And then two, we have other commercial payers that pick up some of the difference. So as you go around the state of Georgia, you will see healthcare entities making like 2 or 3% margin. And you have to make margin even as a nonprofit entity, so that you can finance new equipment, new plants, and new buildings and things like that. You just Ron just mentioned the new Columbia County Hospital. That money is going to come out of operations. So if we don't make money, things like that do not happen. So the cuts that we're going to be seeing here in the next 10 years is going to mean a lot to us. And again, we have to make sure that we stay in business, or we stay in operation, because a lot of people depend on us to offer the service that we offer. Most of the times, you would hear that the U.S. or this country or the U.S. doesn't have a national healthcare plan or something like that, but it does exist. But it's who pays for it. You're talking about if you're a patient and you end up in any hospital, every hospital's emergency room, because of EMTALA, which obligates hospitals to actually see you and make sure that we can get you healthy. We know most of the time eat that part of the claim, which nobody pays for. So we offer charity and bad debt services to individuals who cannot fully afford their claim. So anything that comes down the pike with Medicare and Medicaid impacts us adversely, because if you don't get payment, then these individuals become uninsured and do not have insurance to pay for their services. And the projection on the big beautiful bill is that close to 10 million people are going to be uninsured as we go forward. And that's and this is a national number. In Georgia, the numbers will be a little less. Like I said, we didn't expand Medicaid, so some of the hits are not going to get to us. But when you talk about the health insurance exchanges, and by that I'm talking about Obamacare, the subsidies that a lot of these patients are getting to be able to afford Obamacare is going to slowly go away totally or be reduced drastically. That it's not going to be profitable for all these insurance companies to actually participate in it. So we're looking at a good number of people who are currently opting for the health insurance exchanges, basically dropping out and becoming uninsured patients at our hospitals. And that's a big deal to us.
We got to back up a little bit because you said how much was the cut? 320 million?
$320 billion over the 10-year period for all the cuts are related to healthcare. Yeah.
Okay, billion. I heard that
billion.
wrong, but I was hoping I heard it wrong. I'm gonna have to digest that a little bit. That's a massive cut. But the one question I did have that you brought up was you said 10 million people will become uninsured. You're talking in the state of Georgia, or is that like nationwide?
This is nationwide.
Nationwide.
Yes.
And then do we know how many are uninsured now, like percentage wise in Georgia?
From the top of my head, I do not have that number, but I can get it for you later.
Yeah, I just wondered, and it seems like you guys are already, sounds like at Wellstar Health Systems, already getting ahead of the curve to try to navigate the cuts that are going to happen here in a few months, actually.
Yep.
I think people think it's far away, but no, this will be January of 2026. This is one of the main reasons the government is currently shut down, because there's no agreement on, making sure these subsidies get cut, because it will make people uninsured because they just won't be able to afford health care.
Yep. So, you are correct.
Yeah. So, but it sounds like you guys are already making sure you have reimbursement policies in place. Also, it sounds like you're hedging above the cut. So it seems like you're tracking it. Is that right with Wellstar Health Systems?
Yes, we are. We've actually done some work in that area to actually find out exactly how this is going to impact us. And we have some numbers. The numbers don't really look great because we already provide close to $1.2 billion in community benefits, and the majority of that is charity and bad debt for our patients. So anything that adds to that basically becomes a problem. Yeah, because again, like I said earlier on, we rely on the little money that we get to basically invest that money in projects like the Columbia County hospital projects, and we've done some projects here too at Kennestone Hospital. We have a new tower that went up. There's actually a project also in Arkworth that is currently being planned and basically getting to implementation. So the little money that we get is very important. So if that money goes away, then the flip side of that is that we cannot afford new equipment and new plant and new buildings to take care of our patients.
Okay. So let me go on to these next questions first before I get into free flow. Will the Medicaid and health insurance exchanges enrollment provisions in the Big Beautiful Bill adversely impact patients and healthcare providers in Georgia?
Yes, it will. And I believe that on the Medicaid side, I mentioned earlier on that the payments that we get from the Medicaid is less than the cost of providing that service. So the state of Georgia has a lot of what we call supplemental payments that basically takes care of some of that loss. And as we all know, Medicaid is a federal and state program. The federal government contributes about 70%, and then the state contributes about 30%. So the cuts that are being made, especially in the area of supplemental payments, are going to impact us directly. And for Wellstar alone, the cuts to the supplemental payments is going to be about $149 million over the 10-year period. So again, as the years go by, the cuts that the big, beautiful bill or HR1 is going to present to us increases by the year. So again, if you think about that, it's a big deal. And in most places, we are basically the largest employer in town. So again, if this happens as it is right now, hospitals like Wellstar would have to make some drastic changes in terms of how much it costs us to provide services to the areas where we serve.
And Ebenezer, this is my question, because I'm hearing a lot, right? And I've been hearing it since before June, because what's impacting, it's going to impact, of course, those who use the healthcare system, which impacts our business owners, which impacts all the people that are in any community. If you have any type of current health element and you end up with one, or if you're just trying to get general health services, has there been any conversations, or can you share anything with what Wellstar may be starting to educate patients on, or starting to tell the community to do to prepare for this, or even your employees? Because if the cuts continue, and it's going to be a massive cut right away, but as things continue, I can imagine the strain on the healthcare system. So is there a preparation happening right now for employees that are in healthcare, or even for those who are going to need healthcare in the near future?
Those discussions are happening at the highest level because again, most of these cuts are going to basically come gradually over a 10-year period. So as inconvenient as this is, we also have to basically plan gradually to deal with what is going to happen. So at Wellstar, we are basically looking at cost on the cost side to do the best we can to reduce the cost, to be as cost efficient as we can, and then deal with the reimbursement side as we go along. And I think the state of Georgia is doing some things to also improve the supplemental payments that we get, to make sure that that basically fills an area that helps hospitals to take care of the uninsured patients. So we are doing things, but again, this came very fast. So every entity around the country has to slowly adjust to what is going to happen. Is going to happen down the road.
Got you. Okay. So yeah, and I understand that. I was just wondering if there's any like major campaigns yet that's rolled out that you can share with us, because I could just imagine it has to be a retraining of now the citizens, yep, business owners, which are citizens, those who of us, because we have an aging population, so a lot of us are at a point where we're taking care of our parents, or concerned about that piece, and then also just in general, and then the employees. So yep, it'll be interesting to see what hospitals do to prepare that shift for the even though it's the gradual cuts, but I think you're going to feel the first immediate effects really quickly, and then 10 years is not long. I mean,
Yep.
It goes really quickly. So it may seem like a long time, but it's really not. It goes really quickly. It seems like it was just 2020 and we're already in 2025, getting ready to hit 2026. So it's definitely eye-opening. Now let me ask you the next question. Is the state of Georgia implementing Medicaid and health insurance exchanges related to policies to that will negative impact, navigate, sorry, I think the big beautiful bill on patients and businesses. So are they any more hedges that the state of Georgia are taking to try to, make sure we don't feel it as hard as
Yes,
will?
yes. I think I attended a conference about a couple of weeks ago, and what the Georgia Hospital Association has been presenting is that the state is working hard to basically fill the gap in the HIE subsidy cuts that are going to come down the line.
Uh-huh.
But again, there's a limited amount of resources that can be brought to bear because most of us don't like increased taxes, especially at at the state level. But there are some things being done right now to make sure that individuals who cannot afford, who cannot afford the the premiums
Mhm.
on the health insurance exchanges have some other avenues to get that. And again, all this happened so fast that the state, hospitals, and even nationally, people are slowly beginning to adjust to it. So it's, any news on a lot of these things, I think, would happen sometime around January. Going forward is when people will actually see exactly what is being done to them. So we all have to wait, but there is some positive information coming from the state in terms of trying to bridge that gap. It's going to be difficult, but there are plans to try to bridge that gap. The sad thing is that with all of this, where the bottom line ends up is at the hospitals because we have a commitment to take care of any patient who shows up at our door. So even if the state doesn't do anything, the hospitals, if they are still open, are obligated to take care of any patients that come through the emergency room, and that's what the problem is. And as these most of these people lose their health insurance through HIEs, one, the first thing they would miss is that they can no longer see their PCPs, the primary care providers. So they will have to be really sick to actually get to the hospital, and by the time they get there, the issue or the problem they have will be so acute that the hospital will have to expend a lot of resources to take care of them, and that's a huge problem.
Okay. So do we I guess what else can you share for people to get prepared for the changes? Because this may, I mean, hopefully this is not the first time a lot of people are hearing this, but it may be. We've been talking about this all year because we knew there's going to be massive changes. And unfortunately, some people will still not realize it until they see it. And they'll be like, oh my God, what happened? So, but it's, what ways can they begin to prepare today, or what steps can they take for them and their families and their employees and themselves?
Yeah, the first thing I would say is that if you are someone who has a health insurance, a health exchange plan, that you contact the plan, the entity that runs the plan, just to talk to them up front about what kinds of changes are coming down, just to make sure that yeah, because they have some ways of moving money around to take care of the people who actually are enrolled in the program. So the first thing you would do is you contact them and then see what the gauge is. And then the next thing also is to make sure that if you're told anything adverse and you cannot afford exactly what the premium is, that you find some ways within the state level. By that I'm talking about the Department of Community Health arena, to try to find out exactly what programs the state has in place to actually basically defray some of the increased premiums that are going to come down the line. But apart from that, I think if individuals begin to lose access to healthcare because they cannot afford premiums, the worst thing is for people to basically track down to the hospital emergency rooms, because these in most cases these diagnoses or whatever wouldn't be severe enough for these individuals to come to the emergency room. But if you have no other resource, then basically that's where you end up, and then hospitals are obligated, to take care of you once you get there.
So, from what I heard you say, this is what the first thing to do is to confirm the increase. So, confirm with your current provider what the possible increase is. And now I don't know if this is true, but I actually seen full-time employees start, because it is open enrollment season, say that their insurance at their employer is going higher as well. So I'm starting to see those complaints. So just confirm with your current provider or through your company, or even if you're going through an exchange, because there's a lot of folks who help with those insurance. We have a lot of members that help with insurance. Contact them to see what the cost increase may be. And then after that, it looks like if you can't afford that, find help from the state. So it looks like you're suggesting people to figure out what programs are provided through the state to help supplement your costs.
Yep.
And then lastly, unfortunately, which is like a last resort, you may show up at the emergency room to get the assistance you need.
Yep.
Okay. Hey, Ebenezer, anything else that you could give us that's like a silver lining? I don't want to live on a sour note. This is a very critical conversation. I think a lot of people are starting to realize what is happening. So I've been getting the question more lately. I'm like, yes, we here at the chamber been covering this all year and been discussing insurance all year, because we knew this was one thing that was going to impact our community really heavily. So anything that you can live us on a high note a little bit, so we don't scare the folks so much.
Sure. Yes, I think in the business that you are in, healthcare, like I said earlier on, usually is the largest employer in most of the towns here in Georgia, and most hospitals are doing the best they can to invest in those areas where they operate. You mentioned earlier on the Columbia County Hospital, a new hospital that we look to open sometime in August or September next year. It's a big deal. It's an improvement for the area where the hospital is located. We plan on beginning the build of a hospital in Acworth. That's also a big deal. And in most of the areas where we serve, Wellstar, I mentioned earlier on that I've been with Wellstar for 16 years, and they do not take the layoffs and things like that as something that we need to do. So we do the best we can to basically absorb and be cost effective as much as possible, so that we can continue to go to the restaurants, to have employees go to restaurants, go to your local hardware store, and also participate in all of the other areas that businesses offer in the areas where we serve. So people do it the best we can to be more cost effective. And by doing that, we help you all maintain the businesses that you run. That's the positive note that
Thank
I can
you.
put on this, because everything else is looking, is with the government shutdown, and also with the anticipation of all these cuts coming down the pike. We all have to be positive and optimistic that after all this, something great is going to happen at the end of it.
I believe it. I believe it. I know one of my biggest things I have said throughout this whole year is that it's gonna come back down to that community and how much we support and collaborate with each other. And one thing I know about the CSRA is that we'll pull together to get through things. So I do believe that those resources that we may not have thought about or unique ways to help our citizens will come out of all the changes that we are experiencing as a nation, as a state or locality, and we will figure it out, is so to say, and it will strengthen our local communities because you'll see that the resources you have locally will become that main,
Excellent.
heartbeat, right? The
Yep.
foundation for everybody to run their business, to live daily, to have healthcare, to have food, and so forth. So I do see that happening. That's one thing I have been saying. Even with all the changes, I do believe that is what's going to happen. And I know the CSRA is strong, and we have a unique position where we have a strong farming community here, a lot of healthcare folks already here, and we got a new hospital coming in the region thanks to Wellstar Health System. So Ebenezer, I appreciate you for spending time with me today. I know it was kind of crazy to get this live started, but you have been so patient and so wonderful and gave us a lot of information, and even me understanding cuts that I didn't realize. That $320 billion number will stick in my head for a while. So
Yep.
that's a pretty massive number I was not aware of. But anything else you want to share with the folks before we close out?
Thank you so much, Ronick, for giving us giving me this opportunity to present the information that I presented, and I greatly appreciate it.
Thank you, thank you, thank you. And thank you for all your years of service in the healthcare industry and your years at Wellstar. Wellstar Health Systems is a great partner of the Great Augusta Black Chamber of Commerce, and we're excited to continue to partner with them and just spread information to our communities, and also making sure it's ways to help and support. So make sure you're connected to the chamber, guys. Make sure if you're not a member, become a member. We encourage you to join the organizations. You can support our things we're doing, but if you're not, make sure you join on a non-member list. We will be sending out a lot of information, as we have been during the government shutdown, in ways that you can get assistance and help and so forth. As here, of course, our first priority is support the business community, but we know the business community needs to make sure we're supporting the greater community, because it's just how the cycle works, and we need to have a full community to make sure things are running smoothly. So Ebenezer, I appreciate you. I hope you have a great weekend. Thank you for
Me
everything that you
too.
do and joining us today. And be sure to share this out, guys. There's a lot of people coming into the room. Make sure you share out this information and so forth, so people can be aware and get themselves prepared for the changes ahead. Have a good day. Remember, we're one community, one voice. Connect with us. Join us. Contact the team. Just go to our website. We'll be happy to connect with you guys. Thank you.
Yeah, bye bye.